They called it the most callous criminal enterprise ever prosecuted in the history of New York healthcare. $1.8 billion. Stolen not from banks, not from corporations, stolen from the sick, from the dying. From men and women who could not speak for themselves, could not read their own billing records, and trusted the people changing their bedsheets with their lives. 11,000 Medicare and Medicaid patients billed for treatments they never received. Medications dispensed on paper that were never dispensed in reality. Rehabilitation sessions logged in federal systems for patients who had been bedridden and non-responsive for months. And at the center of every falsified chart, every ghost procedure, every stolen dollar, a syndicate. Organized, protected, and connected to a criminal financial network that reached from the Bronx all the way to offshore accounts in 3 countries. This is not a story about billing errors. This is not a story about administrative negligence. This is a story about a healthcare empire built on the suffering of the elderly, the disabled, and the dying. And before this ends, you will understand that what happened inside those facilities in the Bronx and across New York City was not just fraud. It was engineered. It was commanded. And it was protected from the inside. The next part is worse. Stay with us. 2:48 in the morning. The Bronx, New York City. The Grand Concourse is nearly empty at this hour. A few yellow cabs moving south, steam rising from the subway grates in slow gray columns. The corner bodegas still lit, still open, because in the Bronx, some things never fully close. And somewhere above the low skyline, an FBI surveillance helicopter holding position at altitude, its thermal systems locked onto 4 separate locations simultaneously, watching. Heat signatures move through the floors of buildings that present to the world as places of healing. They do not look like cartel targets. They look like nursing homes. But tonight, they are raid targets. On Jerome Avenue, in a 6-story facility called Grandview Continuing Care Center, approximately 44 staff members are on overnight shift, fewer than the federal billing. Records suggest because the billing records have been lying for 4 consecutive years. 3 blocks east, the administrative offices of Meridian Senior Health Partners occupy 2 floors of a commercial building with clean lobby signage and a website listing a medical advisory board that does not exist. In Mott Haven, a pharmacy operating as a licensed distributor under the name PharmaCore Medical Supply is still processing electronic prescriptions at 2:48 in the morning because the prescription volume it handles has nothing to do with genuine patient need and everything to do with keeping a billing engine running 24 hours a day. Outside all 3 locations, and at a 4th address in Fordham, a data center registered as a healthcare company, they are already in position. FBI. DEA. D's Homeland Security Investigations. The U.S. Attorney's Healthcare Fraud Strike Force, operating under a sealed grand jury indictment signed 48 hours prior. ICE Financial Crimes Units. 3 SWAT teams in full tactical gear, and 24 plainclothes agents inside marked federal vehicles covering every exit on every block. The operation is called Project Hollowchart, and tonight, 4 years of investigation become 4 minutes of action. 3:04 a.m. All 4 locations. Simultaneous entry. At Grandview, the front and rear entrances come down in the same breath. Agents in black tactical gear move through the lobby past a reception desk where a night attendant stares in motionless shock, past the nurse's station on the 2nd floor where 3 staff members are at computers doing what staff members at 3 a.m. should not be doing, entering procedure codes and physician authorization signatures for patients who have not seen a physician this week. 2 of them reach for phones. Neither phone call gets made. At the Meridian administrative offices, SWAT breaches through the main door and the fire stair access simultaneously. The office is not empty at 3 a.m. There are 7 people inside, not nurses, not doctors, but billing coders and data entry workers moving through electronic health record systems with a speed and volume that no legitimate overnight billing operation would require. 3 servers along the west wall are mid-process on what forensic analysts will later determine is a scheduled overnight batch submission of 4,217 fraudulent Medicare claims totaling approximately $9 million. The submission is stopped with 11 minutes to spare before it clears the federal processing window. At PharmaCorp, agents find something that stops them cold even before the building is fully secured. A rear storage room, accessed through a door that does not appear on the facility's licensed floor plan, contains pharmaceutical inventory that does not match any patient roster, any prescription record, or any licensed distribution manifest. Oxycodone. Hydrocodone. High-volume controlled substance stockpiles in quantities that suggest not pharmaceutical distribution, but pharmaceutical diversion. Medications billed to Medicare patients who never received them, resold into street-level networks through distribution channels that federal agents have been tracking in a parallel DEA investigation for 14 months. And at the Fordham Data Center, the operation's digital backbone, agents seize 41 servers, 63 encrypted hard drives, and a room-length rack of storage systems, processing the billing records, patient data fabrications, physician credential forgeries, and financial routing instructions for the entire network. But it is in a locked filing room on the data center's 3rd floor, a room requiring a biometric key and a secondary PIN, that the investigation changes entirely. 3 fireproof cabinets. Inside them, physical binders organized by facility name, by calendar quarter, by payer category. And in the back of the 3rd cabinet, a sealed envelope containing a single USB drive, a handwritten routing ledger, and a series of authorization documents bearing the digital signature prefix of one man. Regional Director Cassius Braun, fictional administrator of New York's Metropolitan Healthcare Compliance Authority, a man who has appeared at press conferences praising the state's commitment to elder care protections. A man who has testified before a state legislative committee about Medicaid fraud prevention. A man who, the handwritten ledger makes clear, has been running it. One agent photographs every page of the ledger. Another bags the USB drive. A third gets on a secure line to the case supervisor and says 4 words. We found the director. 7:22 a.m., FBI Cyber Forensics Division. Federal Plaza, Lower Manhattan. The room has the particular stillness of people who have been working all night and found something they cannot stop looking at. 15 analysts. 4 projection walls. And a network diagram so complex it initially looks like abstract art until you follow the lines. This is Project Hollowchart and the case supervisor, a 20-year veteran of healthcare fraud prosecution who thought he had seen the full spectrum of what organized crime could do to a healthcare system, is standing in front of that diagram with his arms crossed and his expression unreadable. He is trying to decide if he is looking at a fraud network or a financial institution. 57 shell companies, spread across New York, New Jersey, Florida, and Delaware. Ghost medical corporations with names like Brightfield Medical Consulting Group, Northeast Patient Advocacy Partners, and Meridian Care Management Solutions, all bearing legitimate state registration documents, several of them credentialed by healthcare accreditation bodies whose review processes, investigators will later discover, were compromised by falsified documentation submitted under physician identities stolen from legitimate doctors in 3 states. Offshore accounts in the Cayman Islands. A financial services entity in Malta that has appeared in 2 previous federal money laundering cases and survived both. A charitable foundation, the Greater New York Elder Wellness Initiative, registered as a 501c3, publicly fundraising for senior nutrition programs, that has dispersed precisely $0 to any senior nutrition program, but has processed over $84 million in laundered transfers in the past 31 months. Restaurant groups in Queens and Brooklyn. A commercial real estate holding company in the Bronx. A medical supply logistics firm operating out of Newark with delivery contracts to 17 licensed healthcare facilities, 11 of which are part of the fraud network. And flowing through all of it, the money. moving from falsified Medicare and Medicaid reimbursements through billing entities, through consulting fees, through management contracts, through the offshore structure, and back. Clean, documented, untouchable, into the personal and business accounts of the network's leadership, including Regional Director Cassius Braun, whose financial forensics show a personal net worth increase of approximately $14 million over 4 years on a public sector salary of $112,000 annually. The USB drive recovered from the Fordham data center unlocks a master file. The analysts name it Project Hollow Chart Phase 2. And what it contains is not just a fraud operation. It is an expansion plan. 23 additional healthcare facilities across New York City and the greater metropolitan area, some already partially infiltrated, some targeted for management takeover. Through fabricated regulatory citations issued by Braun's Compliance Authority, forcing facilities into administrative receivership and allowing network-affiliated management companies to assume operational control. A mechanism for using the regulatory power of a state healthcare oversight office as a weapon to absorb legitimate care facilities into a criminal enterprise. The network had not just corrupted the healthcare system, it had been building a mechanism to own it. The lead forensic analyst pulls up the financial architecture summary and reads the total. $1.8 billion in fraudulent federal healthcare claims over 4 years. She sets down her coffee. This is not corruption, she says. This is command-level collusion. Braun did not look away from the fraud. He engineered the regulatory cover that made it invisible. She looks at the projection wall. And we have not reached the bottom of this yet. 5:15 a.m. The following morning, FBI Joint Task Force Command Center, Federal Plaza, Manhattan. 48 operational personnel. A digital tactical map spanning the full east wall. Across it, 51 red markers pulsing in slow, rhythmic beats. The Bronx, Brooklyn, Queens, Manhattan, Staten Island, Newark, Jersey City, White Plains, Nassau County. 51 confirmed nodes in the New York Healthcare Crime Syndicate's network. All active, all under Braun's administrative protection umbrella. All operating, until this morning, with impunity. The task force commander, a DEA special agent in charge, who came up through financial crimes and healthcare fraud before moving to narcotics. Because the money, she always said, tells you the same story no matter what they are selling, steps to the front of the room. Today we take down all 51. Every team confirms ready at 0530. We move together. 890 federal agents, 26 FBI field teams, 14 DEA financial crimes units, D's Homeland Security investigation cells across every borough, ICE fraud enforcement teams, the U.S. Postal Inspection Service, because mail fraud is woven through the billing architecture like thread through fabric. New York State Police white-collar crime units federally deputized and operating under FBI command protocols, and coordinating with the New York field offices on the pharmaceutical diversion component, Drug Enforcement Administration tactical support units covering the controlled substance supply chain nodes identified in the overnight forensics review. At 5:30 a.m., 51 operations begin simultaneously across the New York metropolitan area. In the Bronx, at Grandview, and at 2 additional long-term care facilities enrolled in the network, Riverside Continuing Care Associates and Parkview Skilled Nursing Center. Federal health inspectors and FBI agents move through patient floors room by room while forensic accountants seize every billing terminal, every electronic health record, workstation, every physician credentialing file and medication administration log. What they find in the patient charts is devastating in a way that the financial numbers alone cannot convey. Patients listed as receiving daily physical therapy who have not left their beds in 6 months. Patients billed for wound care procedures whose charts contain no wound documentation. Patients listed as receiving psychiatric evaluation services who have not been evaluated by any mental health professional since admission. In Brooklyn, a pharmaceutical distribution warehouse, PharmaCorp's secondary facility, larger than the Bronx location and unknown to investigators until the overnight forensics, revealed it through cross-referenced shipping manifests, is hit by a joint DEA and FBI team. Inside, controlled substance inventory valued at approximately $11 million. Medications diverted from the Medicare billing pipeline, stockpiled and resold through a distribution network with connections to street-level drug operations in 3 boroughs. The facility's manager, a former licensed pharmacist whose credentials were revoked in 2019, is taken into custody without resistance. He asks only one question. He asks if Braun has been arrested yet. In Queens, the Greater New York Elder Wellness Initiative's registered office address, a small commercial suite used primarily to maintain the foundation's legal legitimacy, is searched and sealed. Investigators remove financial records documenting $84 million in transactions that will each require individual tracing through 3 separate offshore layering structures. In Manhattan's Midtown, at a private office suite registered to a healthcare consulting firm that serves as one of Braun's personal financial relay entities, agents arrest 3 financial architects, a former healthcare attorney, a retired CPA with prior federal fraud history, and a billing systems engineer who designed the automated claim generation software that enabled the network to process fraudulent submissions at machine speed, volume, and consistency no human billing team could sustain. And in Riverdale, at 6:08 a.m., federal agents arrest Regional Director Cassius Braun at the entrance to a private fitness club where he arrives every Tuesday and Thursday at the same time, with the same routine, with the confidence of a man who believes he has made himself untouchable. He is not. He says nothing when the handcuffs close. But the agents note that he looks, for just a moment, not frightened, but calculating, still running numbers, still looking for an angle. There is no angle left. By early afternoon, 412 arrests across the network, including Braun, 29 nurses and clinical staff who falsified patient records under supervisory, direction and financial inducement, 16 billing administrators, 7 facility directors, 11 financial intermediaries, and 22 individuals connected to the pharmaceutical diversion operation. Fraudulent billing records seized, covering over 11,000 individual patient accounts across a 4-year period. Controlled substances recovered, street value exceeding $17 million. Cash and financial instruments seized across all locations, approximately $31 million. The healthcare syndicate absorbed more damage in 8 hours than any federal investigation had inflicted on it in the prior 4 years combined. The 72 hours that follow the raids do not feel like victory. They feel like excavation. Federal investigators working through the seized billing databases, patient records, facility management files, and internal communications begin to reconstruct not just what happened, but how long it was allowed to happen. And what they find inside the regulatory architecture makes the fraud itself almost secondary. Cassius Braun's Metropolitan Healthcare Compliance Authority, the state body charged with auditing, inspecting, and sanctioning New York healthcare facilities, had, under his direction, become the primary instrument of the network's protection. Inspection schedules for network-affiliated facilities had been systematically manipulated. When federal or state routine audit cycles approached a network facility, internal advance notice was delivered through an encrypted communication relay, not to the facilities. Legitimate management, but to the network's operational coordinator, giving the facility between 48 and 96 hours to adjust records, relocate non-compliant documentation, and brief staff on responses to auditor questions. Complaint records tell the most shattering part of the story. Families of patients at network facilities had filed a combined 307 formal complaints with Braun's compliance authority over the preceding 4 years. Complaints about neglect, about medications that seemed wrong, about billing statements that listed procedures family members knew had never happened, about staff shortages, about the slow deterioration of loved ones whose care was not what the invoices described. Every complaint entered Braun's system. A database query run by federal investigators reveals the outcome of all 307. 291 were marked closed, insufficient evidence to proceed. 12 were marked referred for secondary review, and then marked closed 6 to 8 weeks later. 4 remained technically open in perpetuity, assigned to a caseload queue that had not been actively worked in over 3 years. Not one resulted in a substantive inspection of a network facility. Not one. A veteran FBI agent who specializes in elder abuse investigations reads the complaint database summary and steps away from her workstation for a long moment. When she comes back, she speaks to no one in particular, but loudly enough for the room to hear. 307 families tried. 307 families told someone, and the man they told was the man running it. The Compliance Authority, created to be the last line of protection for New York's most vulnerable patients, had been transformed into the network's first line of defense. A regulatory body weaponized as a shield. Braun had not just corrupted a government office, he had reversed its purpose entirely. Senior inspectors on his staff who were interviewed by federal agents describe a workplace culture of deliberate incuriosity, where asking the wrong questions about a flagged facility led to reassignment, where the unofficial understanding was that certain facilities were to be processed quickly and cleared without escalation. 3 inspectors describe being explicitly told by supervisors whose financial records will later confirm they were on Braun's indirect payroll, that specific. Facilities were under enhanced administrative oversight, and that standard inspection protocols did not apply. 4 of those supervisors are arrested in the second wave of charges. 1 Compliance Authority investigator, a young woman 2 years into her career who had filed an internal escalation about billing anomalies at a Bronx facility and received no response, learns from federal agents that her report was received, logged, and then deleted from the active case management system within 72 hours of submission. She sits in a federal interview room and cries, not for herself, for the patients. The task force commander, reviewing the day's investigative output that evening, says what every person in the room already understands. We did not just find a fraud network inside a regulatory system. We found a regulatory system that had been rebuilt from the inside to function as a fraud network. Braun turned the oversight body into the criminal's best friend. The system will be rebuilt. But we have to be honest about how completely it was dismantled first. Zoom out from the Bronx. Zoom out from New York. The financial architecture of Project Hollowchart, as federal investigators continue to unwind it in the weeks following the raids, does not stop at the state line. The shell company network extends into Florida, where 3 affiliated nursing home management firms operate facilities billing Medicare under the same fraudulent template. Same ghost procedure codes, same phantom physician authorization structure, same batch submission software engineered by the same architect arrested in Midtown. DEA financial crimes analysts identify monetary flows connecting the New York network to healthcare fraud operations in New Jersey, Pennsylvania, and Illinois that have been under separate federal investigation, not previously known to be related. The pharmaceutical diversion pipeline connects to street-level distribution networks in Newark, Philadelphia, and Baltimore. Controlled substances diverted from the Medicare billing system, medications billed to patients who never received them, were feeding an opioid supply chain operating across the Northeast Corridor. The human cost of that pipeline, in overdoses and addiction crises in communities far from any nursing home billing office, is not measurable in federal indictment counts. The offshore financial structure, the Cayman accounts, the Malta entity, the charitable foundation, connects to a private wealth management operation in Cyprus that federal investigators refer to the Treasury Department's Financial Crimes Enforcement Network for international coordination. The money that moved through those structures came from federal healthcare programs funded by American taxpayers, processed through the suffering of 11,000 patients, and ended up in accounts designed never to be found. And then there is the final file recovered from the Fordham data center, not the USB drive found in the cabinet. A deeper partition, requiring a separate decryption key that forensic analysts spend 11 days cracking. Inside, a document Braun's network had internally titled Project Foundation. It is not a fraud schedule. It is not a financial routing plan. It is a vision document, A 5-year strategic plan for the systematic acquisition of healthcare facility management contracts across the entire New York metropolitan area using bronze regulatory. Authority to create the conditions for takeover, facility by facility, borough by borough, until a single criminal network controlled the institutional care of a significant fraction of New York City's elderly and disabled population, not for their care, for their billing codes, for their Medicare numbers, for the federal reimbursement dollars attached to their existence as patients. The network was not planning to steal from the healthcare system. It was planning to become the healthcare system. The lead analyst reads the executive summary of Project Foundation and sets it on the table. This system was not infiltrated, she says. It was being replaced, rebuilt for their future, not for the patients who were supposed to be inside it. Power does not always look like power. That is the first thing this story asks you to understand. It does not always arrive armed. Sometimes it arrives in a pressed administrative uniform, carrying a briefcase, signing inspection clearances, attending legislative hearings, saying the right things about, protecting vulnerable populations, while simultaneously ensuring that those populations have no protection at all. Cassius Braun built $1.8 billion by making sure that the people most harmed by his operation were the people least capable of fighting back. The elderly, the cognitively impaired, the dying. People whose only advocates were family members navigating systems deliberately designed to exhaust and dismiss them. People whose 307 complaints disappeared into a database controlled by the man running the crime. Think about what that number means. 11,000 patients. Not abstractions. People with names and histories and families who visited on Sundays and asked nurses how their mother was doing and received reassuring answers from staff who knew the answers were lies. Think about the medications diverted from their care, painkillers, sedatives, controlled substances billed to their Medicare accounts and sold into street networks, while they may have gone without or received substitutes or received nothing, and no one documented it because documentation was the product being falsified, not the care being provided. Think about the families who called the compliance authority, who wrote letters, who filed formal complaints in good faith, trusting that a government body existed to hear them, and who received closure notices from the desk of the man protecting the operation they were reporting. This is what it looks like when a criminal enterprise is sophisticated enough to occupy the machinery of accountability itself. When it does not fear oversight because it controls oversight. When the regulator and the criminal are the same person wearing different titles on different days. This is what organized crime looks like when it graduates from breaking the law to administering it. Project Hollow Chart is ongoing. The federal investigation into the full scope of the New York healthcare crime syndicate. Its interstate pharmaceutical diversion connections. Its offshore financial architecture, its affiliate networks in Florida, New Jersey, Pennsylvania, and Illinois will take years to fully prosecute. Braun's indictment runs to 187 counts. The patient-victim identification and restitution process has barely begun, and the 307 families who filed complaints they were told amounted to nothing, they deserve to know that those complaints are now federal evidence. Every one of them was right. But something has changed. 890 federal agents went to work before dawn on a Tuesday morning in New York City and found what was hidden in the filing cabinets and the server racks and the compliance databases and the offshore accounts and the patient charts. They found Project Foundation. They found the direction this was heading. And they stopped it. If you are still watching this, tap like so more people hear this story. Because 11,000 patients and their families lived inside this fraud for years, and the least we can do is refuse to let it disappear in silence. Comment expose below if you believe that criminal infiltration of healthcare oversight systems demands the same level of federal attention as any cartel operation. Because the body count, measured in neglect and diversion and stolen care, is just as real. Share this with someone who needs to understand that the most dangerous criminals are sometimes the ones sitting across a government desk, stamping your complaint file closed.